All right, good evening, everyone. Thanks for dialing in and participating in tonight's Prince George's County COVID-19 Tele-Town Hall informational call with County Executive Angela Alsobrooks, administration leaders, and partners. My name is David Sloan from the Office of the County Executive, and I have the privilege of facilitating this evening's call. We're thrilled to have you join the County Executive, administration leadership, and partners on a beautiful evening for a comprehensive update on COVID-19, the impact it's had on our community and county, our government's response and management, and the plans moving forward, and how our community is coming together to respond to events that have shaped the narrative for our nation over the last several weeks. We have a really healthy agenda tonight. You'll receive updates from County Executive Angela Alsobrooks, our County Council Chair, Todd Turner, our County Chief Health Officer, Dr. Ernest Carter, and our county's team of Chief Administrative Officers who will provide background during the agenda and will help with Q&A. We also are really, really happy to move through many questions that were provided by citizens all across our county. We had over several hundred questions come in from you, and we're going to really do a good job here trying to move through those questions and provide the answers. I'd also like to note at the beginning of our Tele-Town Hall that it will be recorded and it will be sent out to everyone in the next 2 days. So with that, I'd like to welcome County Executive Angela Alsobrooks.
Good evening, everyone. I want to begin first by saying thank you so much to David Sloan, who you just heard from, for facilitating tonight's call, and also just want to give a hearty thank you to our entire administration who worked so very, very hard. I want to give a special thank you to Dr. Ernest Carter, who is our Chief Medical Officer. Many of you have had the pleasure of seeing him over the last few months as he gave us updates regarding the coronavirus. You will hear from him again in just a moment. He will provide us updates. But I have to tell you that he is single-handedly the absolute best chief medical officer, not only in the state, but I think he really is one of the strongest in the country, and we are really, really grateful to have him. I think it's an understatement to say that this year has certainly been full of challenges, and so I want to say to each of you listening, first, thanks for dialing in, and secondly, to say to all of you, and especially to our Prince George's County family, thank you so much for your resilience. Thank you for the sacrifices you have made, and we thank you also for your engagement. No matter the challenges we have faced together, I know that we will overcome the issues that our county and country are facing right now, and afterwards, we will be stronger and we will achieve much together. 2020, I want to tell you that regarding the coronavirus in our county, we have established the Prince George's County Forward Task Force. I'm going to talk about that, and also an overview of the steps that we're taking to deal with police reform in the interest of equality and social justice, as well as to give you an update regarding COVID-19. 2020 has been a challenge, and I have to tell you that as we have watched our communities come together to confront the unknown, whether it's been a new illness or in support of social justice reform, I believe that we really have reached a turning point in this country. And what I've seen makes me proud to be a Prince Georgian, and especially proud to be your county executive. And as we continue to work hard to prevent the spread of this illness and to implement meaningful social justice reforms, I am confident that we will be successful. And in Prince George's County, justice, healthcare, and education will be equal for all. As of today, our county has 18,174 confirmed cases of COVID-19, and 629 of our residents have lost their lives to this virus. You've heard me say it before, and I will say it again, 18,174 confirmed cases of people who we love, who have been sick from this virus, and so we certainly keep those individuals as well as those who are grieving, who have lost loved ones in our thoughts and in our prayers, and we will not forget them even as we move forward. Our number of positive cases is now at a record low. During the first week of June, we tested 9,800 residents for the coronavirus. 11.4% of those tests came back positive. The weekly positive test rate continues also to decline. This 11.4% positive rate represents a 2.7% reduction in positive cases over the prior week. Furthermore, this positive rate represents 19.1%, a decline over our all-time high in mid-April. So this decrease in positive cases is promising. We're not done yet. Our county health department is now providing COVID-19 testing at 3 sites: the Rolling Crest Chillum Recreation Center, the Cheverly Health Center, and starting this week, the Laurel Beltsville Senior Activity Center. We plan to open at least 2 additional sites in the central and southern parts of the county later this month. All 3 of our county testing sites are by appointment only. This is to keep you safe, but those with appointments will be accommodated as long as the site can handle the volume. So if you do not have an appointment, but it is urgent, we are not turning away individuals as long as we can handle it. To make sure you aren't turned away, we do recommend that you schedule an appointment by calling 301-883-6627. Effective this past Monday, Prince George's County moved into a modified Phase 2 reopening. Our executive order provides guidance for a number of local businesses, allowing many to reopen with modifications to prevent the spread of COVID-19. A full list of my order, along with all of the requirements, is available at this point on our county website, mypgc.us. Again, our website is mypgc.us. A state of emergency still exists in our county, and I should remind everyone that we are not back to business as usual. In fact, I don't believe that we will be back to business as usual for quite some time. We are continuing to encourage residents to stay home as much as possible, to wash their hands, and to practice social distancing. COVID-19 is still present in our community. So face coverings are still required on public transportation and in all of our stores. And for the staff of these partially reopened establishments interacting with our customers, these facial coverings are critically important. So please do wear them so that we can keep everyone safe, but most especially our essential workers and those who are working in our stores and establishments. Of course, we are encouraging all of our residents to stay vigilant. Just as quickly as the COVID-19 pandemic started, it can start again. And so we must all do our part to help our community limit the spread of this virus. I have some good news for you, and that is that despite the economic impact of this pandemic, all 3 of the financial ratings agencies, Fitch, Moody's, and Standard & Poor's, have maintained the county's AAA bond rating and stable economic outlook. What that means is that Prince George's County, in spite of everything we have experienced, still maintains a perfect credit score. Despite a loss of $130 million in revenue heading into fiscal year 2021, our continued sound financial policies have allowed us to maintain our ability to manage our obligations in a fiscally responsible way. Prince George's County remains the economic engine in the state of Maryland and in the region, and these ratings show us what we already know. The coronavirus will not have the final say in Prince George's County. We will emerge from this crisis stronger than ever, and we are working on gathering the best information available to help our county recover. Now, to help us forge a path forward, we have recently convened the Prince George's County Forward Task Force. We've assembled a group of experts in public health, business, and government to generate well-reasoned and well-researched recommendations to aid our community as we seek to restore and move forward. The task force combines new data with expertise to advise our county on this pandemic. We are so lucky. We have 2 seasoned leaders who are coordinating the efforts of the task force. Our co-chairs are Dr. Charlene Dukes, president of Prince George's County Community College, and Mr. William Von Haney, Jr., who is Senior Vice President and Chief Strategy Officer of Exelon. And so I want to thank these 2 dynamic leaders who have agreed to serve us as leaders and chairs of our task force. The task force will provide real-time recommendations that come directly to my desk. The rest of the team includes internal membership, employees who already work for the county government. It also includes external membership, including key organizations like the Maryland Transportation Institute. Now, MTI helps make this task force more effective because they use state-of-the-art data that enables more granular decision-making. For example, MTI can show our task force how high traffic locations across Prince George's County can prevent We can use the data that is provided there the data to prevent the spread of COVID-19. The truth is none of us have ever lived through something like this before. So it is important to use the best data available and to rely on the advice of experts to help keep residents safe and secure. I'm excited about this task force and the partnership our county has formed, and I know that their work will be invaluable as we reopen. I want to tell you also about another exciting partnership and want to thank Care First. Our county health department has partnered with Care First Blue Cross Blue Shield. This partnership will allow our county to leverage the resources of Care First to provide better care for our residents. Care First will assist Prince George's County with communication strategies and tactics for consistent health-related messaging, food distribution, and COVID-19, enacting also as our COVID-19 call center. Through the efforts of our county health department with Care First, we will communicate steps to mitigate the risk of COVID-19, provide information on available testing sites, and provide information on the use of contact tracers. Now, we're also working with Care First to establish additional food distribution locations in the county and look forward to sharing details on these efforts very soon. In addition to these important efforts, Prince George's County is working with Care First to assist with a number of important tasks. For example, we're working to adapt the health department's COVID-19 hotline call center for future use. And so this exciting broad partnership is still developing. We'll be sure to provide updates on it, but I really do just want to thank Care First. They actually stepped forward and offered their services to us free of charge, and I really want to thank them for doing that. They came to us and said they wanted to be of assistance. Now, regarding police reform and social justice, we have focused much of our attention, as you know, on the health of our residents, but preserving life is one of the most important jobs our county government does. And now as our society is starting to confront another threat to life, the social justice movement is just as urgent. Americans across our country and people all over the world are calling for reforms, and these reforms have the same important goal, preserving life. We know that the tragic killings of George Floyd, Breonna Taylor, Emmett Till, and so many others remind me of my great-grandfather who decades ago, my family moved to Prince George's County after having fled Seneca, South Carolina, after my great-grandfather was shot and killed by a sheriff's deputy. This community, this country, and the world has stood up together now and said enough is enough. And so as your fellow resident and your county executive, I am so proud to stand up with you and to announce real changes. Earlier this week, you heard that I announced a shift in our county resources where we will simply realign $20 million from our public safety capital budget, the police department's capital budget, to build a new health facility. This health facility will work to address mental health and addiction, and I'm really excited about this. Some of you have heard me speak over the years about the 70% of the people who are arrested in Prince George's County who arrive at our Department of Corrections intoxicated. It was so stunning for me to learn that from the Department of Corrections, that not only are 70% of the people they arrest intoxicated when they arrive, but a third of all the individuals who come through our jail are suffering from mental health conditions. In my estimation, it is immoral to treat mentally ill and addicted people only in jail, and I believe that we must preserve the dignity of these individuals. And for this reason, I am realigning resources to ensure that our vulnerable population in our community has access to the help they need from medical professionals. Simply put, police officers are not trained to deal with mentally ill and addicted people. They are, but they should not have to. This health facility will provide qualified medical staff who can provide the right care that those individuals need. Furthermore, what I can tell you is that we are working together to provide responsible policing policies, good policies, because we know that responsible policing requires good policy, adequate training, and strong accountability measures, which describes the approach that we have taken as a county. In fact, you've heard a lot nationally about the 8 Can't Wait proposals that have gained national attention, but I want you to know that these reforms have been a part of our government for at least the past decade. This approach is one that can have Prince George's County serve, I believe, as a model for a successful relationship between law enforcement and residents, but we must continue to seek improvement. In fact, I have been working on improving some of our important policies with the police department. I call for our Prince George's County police officers to be retrained from top to bottom, and steps have been taken to implement that training. Regarding mental health care for our officers, we made improvements such as an independent psychological services component that treats officers on an as-needed basis and an active peer support program. Furthermore, every officer involved in a critical incident must undergo a debriefing by psychological services prior to returning to duty, but we know that we must take that further, and I'm working on a plan to enhance the services and the requirements for mental health treatment in our department. We've also implemented a community policing plan, and our officers have been taking yearly implicit bias training. In addition to our formal complaint process, we have worked on ways that the public can weigh in on their interactions with the police, such as a community advisory council in each district, and our department has made revisions to the use of force guidelines and mechanisms like the daily crime report that allow us to look at how our police department performs in real time. As you know, our police body-worn camera program is now fully funded. One squad per district is already outfitted, and District 4 is expected to be completed by mid-July. We will have a balance of operational components that will be done by December 31st, 2020, and we already have 100% deployment of in-car cameras. In addition, I'm establishing a work group of stakeholders, thought leaders, community advocates, and organizers who will examine the policies and practices of the county's police department, but we can't stop here. And I must say to you something that I think is so important. In this moment of change, and this is a wonderful moment of change throughout our country, it is important to address injustice in policing. But if we stop there, we will have missed the moment. Now is the time to look at the social injustices that have harmed African American communities for centuries. These disparities include health care and education, the economic disparities, and work toward those reforms as well. And so I believe that this is a wonderful moment, an opportunity to look at every injustice across the line, not only injustice, when we walk away from this moment, I believe that we have the opportunity to really practices and reforms that we have.
So, County Executive also Brooks, and you're beginning to break up a little bit on your line. Yeah. So, ma'am, County Executive also Brooks, you're coming in a little choppy. Okay. Ma'am, we're going to work on your line, and I'd like to thank everybody for joining tonight. You just heard from County Executive also Brooks. We're going to go to Dr. Carter and then come back to the County Executive during Q&A. And after Dr. Carter, I believe we have Congressman Brown joining us. Also, I'd like to note that over 23,000 people have joined us so far tonight. So we want to thank you all for taking the time, and the number's still climbing. So while we work on the County Executive's line, Dr. Carter, why don't you take it?
Thank you, David. Good evening. And thank you, Madam County Executive. Just a brief update on our current health status here in Prince George's County. I'm really happy to say, along with the statistics that the county exec gave, in the last 24 hours, we've only had 74 new cases and only one death in the last 24 hours, and that's very, very good. Our infection rate has dropped below 0.9. That means that the virus has slowed down and we have a slow spread. And that's also exciting, as well as as the county executive said, our positivity rate is 10.3, which tells us that our testing capacity has really gotten to the point where we can start to make some real decisions, although I will say we want it less than 5%. Now, I want everyone to keep in mind that these numbers reflect what we did 2 weeks ago, 14 days or more ago. And so we have to keep an eye on that. We're always running behind. So We did really well 2 weeks ago, but we got to continue to do well in order to make sure we keep our infection rate low. Just a quick update on contact tracing. You know, we have efforts in place to do contact tracing for all positive cases to assure that those people who are positive get isolated and those people who come into close contact get notified and quarantined and made aware of the signs and symptoms of COVID. Especially if anyone becomes ill, we need to know and make sure they get tested. Currently, we're working with the state's COVID link system to do contact tracing, and we have our internal members, and we have contracted with a vendor who helps us make sure we reach our numbers and be able to do this. Now, one just quick note on contact tracing. This is the tool that we use to stop the spread of the disease. And that's important for you all to know. So when someone calls you, and that's because you're positive, we have to make sure that we reach out to all of those people who have come in contact with you, and we will not share this information with anybody. So I just want you to know that. In terms of our testing, the county exec told you an update on where our current testing sites are and where we're going. I also wanted to add to that we're working closely with partners such as Doctors Hospital and Walmart and CVS to help with our testing, as well as the state itself, who has a testing site out at Six Flags. So we feel very good about our testing expansion at this point. In terms of our hospital surge and what's happening at our hospitals are seeing less and less patients. As a matter of fact, they saw less than 100 COVID patients just last week, and we're at the point where we can say that our capacity has increased to the point where we're greater than 40% in our ICU capacity, and our total inpatients have dropped down to close to 1,000 inpatient beds, and that's very, very good. Our PPE and equipment we're still increasing that and still staying on the ready to make sure we're ready to move forward if any surge or any increase in the spread should happen. So I'd like to thank all of the citizens of Prince George's County for being so diligent in helping us slow the spread down, and I would love for you guys to continue. That's my report. Thank you, David.
Thank you, Dr. Carter. And at this time, I'm going to ask if Congressman Anthony Brown is able to join us. I know that he was trying to get out of session to join us. Sir, are you there?
David, this is Anthony Brown. Can you hear me?
I can hear you, sir.
Great. Am I up?
You are up. Thank you, sir.
Great. Well, first of all, thanks for having me. I want to thank everyone who's on the call tonight. I'm just actually stepping out from my virtual voting session on Capitol Hill, where Congress is taking up the important issues about investments in our transportation infrastructure. We're fighting hard for Prince George's County and all of Maryland, so I'll be brief and then back to that briefing. But thank you for allowing me to participate on this important Tele-Town hall, particularly as our communities, continue to proceed through this phased reopening. And we know that we're not out of the woods yet. I want to take this opportunity to thank County Executive Brooks, who is just doing a phenomenal job. As I have the opportunity to look at county executives across the state, looking at county executives and mayors across the country, that is where we're really seeing the effort that is enabling us to weather and get through this public health crisis, as well as this economic difficult time. She's assembled a fantastic team, so I wanted to take the opportunity to applaud her efforts and say thank you. COVID-19 still poses an enormous threat to our public health and local economy. Each of us needs to do our part to maintain physical distancing, mask wearing, and proper hand hygiene to keep infections down. Congress also has a responsibility to meet this moment and deliver for the American people. Just recently, in response to the concerns that we heard from our small business community, Congress passed into law legislation to provide additional flexibility for the Paycheck Protection Program. And we've done a few things. We're allowing for the forgiveness for expenses beyond the initial 8-week period to now 24 weeks. We're extending the program and the rehiring deadline from June 30th all the way to the end of this year, December 31st. We're increasing the limitation on non-payroll expenses for loan forgiveness from 25 to 40%, and we're extending the loan terms to 5 years. We've heard from our small business community, and we want to ensure that they have the additional supports as we enter the recovery. The pain from this pandemic is still being felt. It will be for a while. Now is not the time for us to hit pause on our relief efforts. So many of you know that the House of Representatives recently passed the HEROES Act. That's our next round of funding. We are waiting for the Senate to act. But what we've done and what we need the Senate to agree to is $75 billion for testing, tracing, and treatment. And you heard Dr. Carter talking about the importance of particularly contact tracing. And also we seek to provide $1 trillion for state and local governments around the country, because let me tell you right now, Prince George's County is not alone. Almost every county and municipality around this country is seeing a reduction, a decline in their revenues. And that's revenues for police, fire, transportation, EMS, teachers, and other vital workers. So we need to get more funds for state and local government. Also, what we passed out of the House includes a second round of direct payments to families up to $6,000. It extends that $600 federal unemployment payment through next January. We also require workplace protections for businesses that are reopening. We increased the SNAP benefit, which is what we used to call a food stamp, and also we're putting in more assistance for renters and homeowners so they can make that monthly rent or mortgage and utility payments. So we need to act now to get aid where it belongs. Let me speak briefly to unemployment. I probably get more calls in my office today about unemployment assistance or benefits. In Maryland, there are too many that have experienced unacceptable delays, denials, and website glitches when applying for state unemployment benefits. Today, there are more than 100,000 Marylanders that are still waiting for a check. Expanding unemployment benefits and providing that additional $600 per week for those out of work due to the pandemic, that was a top priority for Congress, a bipartisan priority. So we need the governor and the Maryland Department of Labor to pick up the ball. They've dropped the ball. They're dismissing concerns, providing excuses. There are unmet promises. This is critically important. We need them to step up. So I will continue to push state officials to quickly fix these well-documented issues. For those of you on the call who are experiencing this, you can call my office for assistance. Do understand it's a state program, but we will do the best that we can to assist you. Let me wrap up with this part, and I know the county executive touched on this as well, and that's police reform and accountability and the racial disparities that we see in the treatment of black men and women by law enforcement. The last several weeks of protests have shined a light on what I consider another virus that has been with this country for decades, and that's the continued disproportionate killing of black men and women at the hands of police. In the 30 years since I've moved to Prince George's County, I've witnessed progress that we've made toward better community policing. We've made reforms. We hold police accountable. And it's true that we still have incidents of wrongful killings at the hands of the Prince George's County Police Department, excessive use of force, abusive treatment by members of our local police department. So we have more work to do. We have to ensure that our officers act not as warriors, but as guardians of our communities, and that they're concerned with the welfare of those they serve and are sworn to protect. And that's why I also applaud the county executive and Prince George's County Council taking concrete steps to reform the practices of policing in our county. Ensuring better access to mental health and addiction. You heard the county executive talking about that, and also just bringing together officials and activists, academics, and community leaders to continue down the path toward true reform. And finally, let me say this. Last week, I joined my colleagues in the Congressional Black Caucus to introduce the George Floyd Justice in Policing Act to transform policing in America. The bill takes steps to create a culture of accountability among police officers. We're banning the chokehold nationwide, stopping no-knock warrants, demilitarizing our police, reforming bad officers or removing them from our streets and allowing for criminal and civil charges for illegal behavior, improving our officer training, and increasing long overdue transparency. We have to also invest in programs that will keep us safe and address the inequities that pervade our communities, whether it's economic, whether it's mental health, housing, education, or health disparities. So I continue to look forward to working with the county executive, with our state officials, and with each and every one of you in the community as we address what I call two pandemics, one the novel coronavirus, and one that age-old, persistent, racist treatment of black men and women by law enforcement. We can solve both of these. We'll do it together. Thank you very much for having me on the call. And David, I'll yield it back over to you.
Thank you, Congressman Anthony Brown, who represents over 660,000 residents, most of which are Prince George's. He is a terrific partner with our county executive and our administration, and we thank him for his service. Now I'd like to turn the microphone over to our county council chair, Mr. Todd Turner, who oversees the operations of our county council and the 11 members who do the work of our county as well.
Thank you very much, David, and thank you, Madam County Executive, for the opportunity to join you this evening on this Tele-Town hall. The council appreciates the opportunity, since we are a partnership here in Prince George's County, to addressing both the COVID-19 response that we're talking about this evening, as well as the social justice efforts that have been going on for years, but more recently within the last few weeks. The county council, since our last Tele-Town hall, has adopted a fiscal year 2021 budget of just over almost $4.5 billion for Prince George's County that will start on July 1st. We took very painful efforts to try to balance our budget, which is required under our county charter. At the same time, we asked for our employees to make a little bit of sacrifice as well, because of the fact that because of COVID-19, we had to fill a gap of over $134 million in less revenue for the upcoming year, and that's just an estimate going into the year, and we'll have to continue to monitor that over that period of time. However, despite the economic situation in Prince George's County, we did adopt the balanced budget, which I think talked to a lot of the issues that we're talking about this evening, some of the health and social services impacts on our residents, and our focus was on doing that, making sure that we utilize the funds in Prince George's County to support our residents and also to support economic growth as we start our recovery here in Prince George's County under the leadership of County Executive Also Brooks. Just this past week, the County Council did adopt legislation to utilize $158 million in funding that we received through the Federal CARES Act. And we want to say thank you both to Congressman Brown, as well as Congressman Hoyer, as well as the entire Senate and House delegation for Maryland to support that effort. Those funds are going directly to assist our residents, as well as to allow our county government to operate and assist those residents. And some of the things that Dr. Carter talked about will be funded through the CARES Act funding that we have. We're hopeful that the federal government will continue its work, as Congressman Brown indicated, moving forward with the HEROES Act at some point to get direct benefits to Prince George's County and to other jurisdictions in order to meet our obligations going forward in the upcoming fiscal year. I will also say, in addition to our budget, which was unanimously adopted, and we appreciated the opportunity to work with both County Executive Also Brooks and her budget team, we also had the opportunity to start the conversation that the County Executive has mentioned this evening about our police department. And I will not repeat what the County Executive has said, but that conversation was important and will continue to be a continuing conversation that the County Council will be part of, as well as our community. I know we received some comments about our kickoff of this event this past Tuesday, but it was an opportunity for us as government to discuss amongst ourselves some of the issues, both good, bad, otherwise, with respect to our police-community relations. It is something that we continue to have to work on as part of our responsibility as your county government. And you have our commitment both at the County Council and you've heard this evening by the County Executive for us to move forward in that endeavor. So thank you again for allowing the County Council to be a part of this evening. We work cooperatively with our department and the Deputy Chief Administrative Officers on the issues that impact our residents. Obviously we have that responsibility both budgetarily, legislation, and our oversight functions as well. So with that, thank you again, David and Madam County Executive, and we'll turn it back over to you.
Thank you, Sarah Turner. Just some housekeeping. I want to also mention that we're now to 40,000 Prince Georgians who have called in and are listening to our COVID-19 Tele-Town Hall. I want to make sure that everyone knows if you've joined late, we will be sending out the recording of tonight's Tele-Town Hall to our contact list, which is over 250,000 Prince Georgians. If you've got a call tonight, you'll get that text message, and we would ask you to text the link to tonight's audio to your friends when you receive it. The county executive earlier mentioned our hotline number, which is 301-883-6627, 803-883-6627, and mypdc.us, where you can get the latest coronavirus information at the click of a button. It also is the place where you can identify the donations you want to make. I also want to highlight our campaign, Stand Up and Deliver, the partnership with the United Way of the National Capital Area. You'll also be able to find information on all of our food pantries and the latest updates on our phased reopenings. And I want to turn to my colleague, Brandon Starks, who I believe has got the county executive back on the line. Brandon?
I do. Yes, I do have her on the line, David.
I'm back here. I apologize, everyone. Can you hear me?
We can hear you.
Okay, good. I was talking up a storm. I didn't realize that my line had cut short, so I am back on the line now.
All right, then, if you want to finish your remarks, we wanted to make sure we got those in before moving on. But I know.
So you know what? I think I'm pretty much done. I was just concluding by thanking everyone, and I do just want to say a really hearty thank you so much to all of our Prince Georgians. I am, just over the moon, so proud to be your county executive. I thank you again for your resilience and for your engagement, and for holding us accountable, and for being the most amazing partners we could imagine. We are going to make it through every challenge we confront together, and we will continue to work not only to rid our community of this virus and to heal our community, but I think it's just such an exciting time for all of us to make sure that we don't miss the moment, not only to see the kinds of changes and bring the kind of justice that we desire relating to police in our communities, but we also have an amazing opportunity to address the injustices around economic disparities, healthcare disparities, educational disparities. And so this is a moment for us together to make sure we realize all of those things together. And I know Prince Georgians are ready to step up, to work together, and to move Prince George's County into the future. So thank you for being on this call. Thank you, David and Brandon and the rest of the team, for the work that you do and for bringing us on this call tonight. Thank you also to Congressman Anthony Brown. Thank you to Chair Todd Turner and all of our other partners who have worked with us so beautifully through this. So thank you all very much. And Dr. Carter and the Health Department team, thank you all so much for your work as well.
Well, thank you, ma'am, and we'll hear from the county executive again during our Q&A, which we are going to get to very, very soon. But now it's time to hear from our Deputy Chief Administrative Officers, of which there are 5. If you don't know what DCAOs do or who they are, I'll remind you from our last call. These individuals have the collective responsibility of overseeing the operations of the over 40 agencies throughout our county's government. They work in collaboration with one another and with agency directors to ensure that our government is performing at as high a level possible. And they work as a team, intentionally and on purpose, because they believe that we are all stronger when we work together. Tonight, outside of the Q&A, you're going to hear from DCAO Angie Rogers and DCAO Tara Jackson. And first, I'd like to start with DCAO Rogers. Go ahead.
Good evening, David. We've been working hard in the economic development cluster to make sure that we are responding to both residents and our county businesses throughout this pandemic. If there is one sort of data point that tells us how hard the county has been hit during this pandemic from an economic perspective, it's probably the number of unemployment claims. we've seen 108,000 of our neighbors become unemployed since March 15th. And so that is a strain on our county's households and also a strain on our county's businesses and an indication of how they're doing. We have stood up 4 new programs during this pandemic to try and alleviate some of that strain. So our Employee Prince George's, which is our workforce organization, stood up an hourly wage employee relief fund, providing cash gift cards to hourly wage workers while they wait for their unemployment benefits to come through. We ended up having just under 3,000 folks who applied for those cash cards, and we were able to serve just under 1,000 of them. And we anticipate that there will be more funds coming to be able to serve even more of those folks. Our county business relief fund, which is really targeting small and minority businesses, contract workers, 1099 independent contractors. We had a $20 million fund to assist those folks. We got 915 businesses that applied to us for those funds. We've been able to put just over $8 million out on the streets to date, and we'll continue those disbursements. We also set up an emergency rental assistance program, helping households who have experienced a disruption of their income due to COVID and could apply for up to $1,800 a month for a maximum of 3 months for assistance. We had over 7,000 households in the county who applied for those funds, which is another just grave indication of the need that COVID-19 has presented. And so our agency partners are working through those applications and making payments to landlords and utility companies as we speak to help those households. And finally, we set up an arts relief fund that did grants to 81 artists and art organizations in the county who experienced a disruption of their programming. We are turning our attention to reopening and recovery. And so as the county exec and others mentioned, we are in phase 2 of a recovery. And David, you mentioned the website mypgc.us that folks can go to in order to see those executive orders and get the details on what's allowed to be open during this period. Also for businesses, we have a single point of contact email, which is reopen Prince George's at co.pg.md.us. Where, if businesses are uncertain during this period, during any of the phases about how they are allowed to be reopened, they can contact us and get some advice. Encourage people to plug into that information because as phase 2 allows us to go back into our retail shops, back into restaurants, back into our churches, our barbershops and beauty salons, our nail salons, there are limits on how we can engage in those activities. There are limits on the number of people, limits on the capacity that these places are meant to hold during this period to make sure that we're continuing to keep people safe. And so all of that detail is at mypgc.us. The last thing I'll say is just turning toward recovery. It was mentioned that the Prince George's Forward Task Force has been stood up, and a work group of that task force is focused on economic recovery. And so we are going to be focused on jobs and how we get our Prince George's residents back to work. We're going to be focused on our business recovery and how we can sustain the county's businesses throughout the next 18 to 24 months, which is, they are likely to still experience disruptions in operations throughout that period, not be back to full capacity. So we'll be thinking that through, and also thinking about our households and how we make sure, particularly that our renters and our homeowners are able to maintain their places to live during this period. So that's what we're focused on in the Economic Development Cluster. And thank you, David, for your time. I'll turn it back to you.
Thank you, ma'am. Now our Deputy Chief Administrative Officer for Government Operations, this is Tara Jackson.
Good evening, David, and thank you, Madam County Executive, for leading us through some very trying times. Let me first emphasize that our government has remained open during the entirety of this pandemic, and all essential services have been provided and many, many non-essential services. You have heard others that have spoken on the line talk about a modified phase 2 that we have entered into in throughout our county. The government as well has a phase in approach for opening back up our facilities, our buildings to more of our employees as well as to the public. Just briefly, tier 1 of that approach, which we are in currently, continues to maximize telework. So you should know that many of our employees are teleworking, and they have been teleworking for several months, and they're performing the functions of the government, albeit doing it in the safety of their homes. In phase 1, we are as well maximizing our customer-facing services or virtual provision of our customer-facing services. We are ensuring that services that were previously provided face-to-face, either in the office or in the building or in the community, can be provided virtually. And lastly, in terms of our phase 1, we are preparing, or in terms of our tier 1, we are preparing for tier 2. And we expect that tier 2 will bring more employees back into our facilities. As well, we will be able to open up our facilities to members of the public, albeit in a way that is limited, probably through appointment and monitored lines. While we're in tier 1, we're making sure that we are preparing our buildings to ready them for more people to enter the building. And that means installing social distancing equipment, appropriate signage, and putting necessary and efficient screening in place. And we're working with our health department to make sure that we do this in a way that protects, again, both our employees and the public. We are placing a very high priority on the safety of our community and our employees. So we expect that we will be in tier 1 for probably at least another 60 days so that we can make sure that we are prepared for the next tier. Our tier 2, again, will see more employees entering into our buildings and the public in a limited way. So I'll just end by saying that we are making every effort to provide the services that we know that our citizens need, and you can always reach out to us if you have any questions or concerns about those services. Thank you, David.
Thank you, DCAO Jackson. I want to thank everyone who has called into tonight's town hall. Looks like we've got our 40,000 neighbors on the line on such a nice evening as we are in the midst of reopening in a phased manner. I just want to make sure that everyone knows that if you have questions, because we're going to move to Q&A now, that you don't hear reflected in the questions that we are going to move through, you can email us directly at pgctownhalls@co.pg.md.us. I'm going to say it two more times. pgctownhalls@co.pg.md.us. Finally, that's pgctownhalls@co.pg.md.us. And we will make it a point to answering everyone who emails a question to that inbox. I also want to make a note that the other Deputy Chief Administrative Officers who are here are Deputy Chief Administrative Officer Dr. Rose Askew for Education, Health, and Human Services, DCAO Mark McGaugh for Public Safety and Homeland Security, and DCAO Floyd Holt for Government Infrastructure, Environmental Services, and Technology, and our Director of Emergency Management, Ronnie Gill. And so if at any point in time anyone wants to provide background on any answers here, please feel free to do so. But the first two questions from Prince Georgians are going to go to Drs. Askew and Carter. You all can tag team each or decide who answers it. On our list, it's the third. Regarding from Lakita Vital, regarding houses of worship, is the 25% occupancy limit based on the occupancy permit or membership? And also, could someone speak to the safety of worshiping together in a building? Also, should face coverings be worn during service? Dr. Askew, let me let you take that one.
Hi, good evening, everyone. Before I answer the question, I do want to say, I want to echo what the county executive has said and what also Dr. Carter said about thanking Prince George's for their sacrifice and diligence in practicing social and physical distancing and wearing masks and doing the simple but important task of washing hands regularly. It's really your efforts that have driven our success and bringing our numbers down. And I also want to thank you for your patience. You know, as I walk through my neighborhood for my evening walks, I run into my friends and neighbors, and they're asking lots of questions about how we're opening and when the next thing will open. And not with frustration, but real understanding and concern for their fellow Prince Georgians and wanting to make sure that they do the right thing. And so, again, thank you all, and it makes me really proud this evening to be a Prince Georgian. So back to the original question. The beginning is the 25% occupancy limit is really based on your occupancy permit, no matter what your membership is. So if you have a permit to have so many people in your space, that's what you have to go on. You certainly may have a greater membership than your occupancy, and I think that's why many of our fabulous churches have multiple services so that they can accommodate their congregation. I will defer to Dr. Carter, but I will say that I think certainly it's important that we do wear masks during services. That is one of the situations where you will be in close contact with folks for quite a bit of time during a service. And one of the things that you can do, not only to protect yourself, but really to protect your fellow parishioners, your fellow congregants, and neighbors and friends, is to wear a mask during services.
Thank you, Dr. Askew. Our next question is from Ms. Brenda Bowen and Shirley Luby. When will American Legion posts be allowed to reopen? They are important to serving veterans. Dr. Carter, Askew, would you like to take that one from a medical perspective?
Very measured and careful in how we've approached reopening the county and county services and county facilities. Absolutely, the veterans community is high on our list of priority communities. You know, everyone's a priority here in the county, of course, but we certainly do pay special attention in many respects to our veterans community and thank them for for their service. We're going to continue to move in a very measured fashion with respect to when particular industries, particular buildings, particular gathering places will open. And we are in the process of putting together a broad plan that will look at some of the specifics as we move forward. Clearly, we have been following a plan that works well for Prince George's. It doesn't, you notice that it doesn't necessarily mirror what the state is doing, and I think we've been very clear that we're doing what's best with respect to Prince George's County. And thank goodness, it seems to be working and working for us well. Dr. Carter, unless there's anything more you'd like to add?
No, I don't have anything really to add to that. I do want to say that we're really keeping a strong eye on our veterans because we know a lot of them fall into that vulnerable space. So we have to be particularly careful. But we will, as Dr. Askew said, continue how we're doing it. And I think we will get to the point where we can safely start to think about opening.
Thank you, Dr. Carter. Dr. Askew. Now we're going to go to the county executive and Dr. Carter for the next two questions, if they would like to tag team or one can take the other. But first, Brandon, I'm going to ask if you've got the county executive on the line. Do you have her? On the line still.
I'm here.
Okay. Thank you, ma'am. What will the county response be to a spike in cases as it reopens? This is from Ms. Nobella Smith.
Well, you know what? I'll let Dr. Carter answer that, but I can tell you that we expect for there to be a spike in cases, and part of that is due to the number of tests that we are doing. So we are increasing our testing capacity every week, and that means that we will see, I think, more infections. I think Dr. Carter, I'll let him answer, from his standpoint. But I think we do expect, as we open, to see more positive cases. I think we'll be looking out for other numbers as well. I think hospitalizations, I think deaths, those kinds of things I think may affect our decision beyond that. But I think we should absolutely expect that as we open and especially if we test more often, that we will see increased positive cases. And some of that has to do with the fact that we are now able to test individuals who are asymptomatic. And we will find that some of those asymptomatic individuals are spreading. We're hoping to stop the spread of it by testing more and more so that asymptomatic individuals will be able to help us through contact tracing. But I think we will certainly see a greater number of cases. And Dr. Carter, I'll hand it to you.
I agree with what you said, Madam County Exec. In addition, we do expect maybe a bump in our positive cases. Our goal then is to watch to see whether or not that's going to be a continuous rise or is that just a flattening or going down. Then we're going to keep a real sharp eye on whether our hospitalizations start to rise and our number of deaths start to rise. If all of those things start to happen and we see a true surge, then we have to go and mitigate that, and we know that. But we'll be watching that over time, and as Madam County Exec said, of course we'll do what we have to do, but we do expect to see some bumps. So an increase in the number of cases may not represent that we're all of a sudden getting ready to go into a second bump. It just means that we're testing more.
But I think I want to add to that also for anyone who is concerned about it, that we will be vigilant and we will be unafraid if the data tells us that it is important for us to do so to begin to close down things again. We won't risk anybody's life. I think we do expect again to see some incremental increases in the numbers of casing, and as we keep saying, because we are trying to get to 15,000 tests per week. But if we see that something dangerous is happening, and I'll follow the advice of the medical professionals like Dr. Carter and the scientists, and we'll also rely on that forward task force that we had with all of the professionals on there, and we'll take their advice about what steps need to be taken to mitigate the further spread and to save lives.
Thank you, ma'am. Thank you, Dr. Carter. We'll keep it in the same subject matter area. This question is from Vanessa McNair. her question is, why is there such a discrepancy between the state and county's reopening phases?
Well, there's a discrepancy because Prince George's County, and I know Madam County Exec will add to this, is in a region where there happens to be airports and where people have traveled. So initially, when the virus was introduced into the region, it spread much more effectively in the D.C., Prince George's County, Montgomery County, Northern Virginia area. And that was different than the other further out counties like Garrett County and Carroll County. So there is a huge differential between what's happening in the metropolitan D.C. region and what happens outside of that metropolitan D.C. region. And so the state naturally looks at averages, and therefore they have to make a decision based on the entire state. And that's why we're out of sync, because we had a surge in our cases. We had to treat our regions differently than how the entire state was treated. And so we had to take measures a little bit more intensely, and we're delayed. But I thank God for our Prince George's County residents. We're catching up because our residents have been social distancing and practicing their hand washing and doing the things that we ask them to do, wearing the mask, and that's helping us catch up. So that's why there's a difference.
Thank you, Dr. Carter.
I just want to add something to that, please, David, if I can. I'd just like to add, so Dr. Carter mentioned our location, our geographic location. I just wanted to add two other factors. One is that we house a large number of essential workers who were required to get out, and so there was some movement there. Remember also that we house a large portion of the federal workforce that was also required to come back and forth for a while to work, and so we had some spread that was attributable to the large number of essential workers we have and who are out and about providing those essential services, as well as those who are part of the federal workforce.
Thank you, ma'am. I'd like to now go to Chair Turner. This question is from Charmonique. I own a barbershop and received an email from the property manager demanding rent or I will be charged a late fee. Why are there no clear guidelines for commercial property owners to follow for reopening?
Thank you very much, David, for that question. And despite the question itself, I think there are pretty clear guidelines right now with respect to eviction in the state of Maryland and in Prince George's County, both for residential as well as commercial properties, as part of the governor's state of emergency, and additional direction by the Court of Appeals, which is the highest court, and the fact that our courts have been not available and been remotely operating. All evictions have been stayed during the course of this state of emergency. The county council did pass legislation working with the county executive, our office of law, as well as stakeholders last week. It's CB 16/2020, emergency legislation to authorize no late fees being implemented, any additional charges during the course of the state of emergency, and up to 90 days after the state of emergency is done. We understand definitely during this emergency, as we're seeing all the needs within Prince George's County, housing is an integral part of that, and we want to be able to maintain people's residence on the residential side as well as our businesses on the commercial side. Obviously, there are resources available off of the county's COVID-19 website. If you find yourself in a situation, either a commercial or a residential landlord is seeking to evict you or to charge you fees, you can file complaints and also get legal assistance as part of that process, because we understand the importance of the home, particularly given this situation. And I know we've done additional outreach through the Department of Health for particularly our homeless population and others who are struggling as a result of COVID-19, and provided some emergency housing for that, including quarantine housing if that's necessary as well. So hopefully that's clear to be able to answer that question with respect to evictions, late fees, and other charges. The legislation also authorizes landlords to enter into payment agreements, which a lot of our landlords have already done, to allow for the residents to maintain not only their residential property but also their commercial property. So hopefully that responds to that question.
Thank you, Chair Turner. And we have time for just a few more questions, so we're going to turn our attention to public safety, summer activities, and education. This next question is directed to DCAO McGaw, and it's from Teresa Miller. What is the county's plan for handling safety issues and trust in police? I live in District 3, and I do not trust or feel protected by the police.
Well, good evening, everyone. And, trust of the community is key for any police department. And we can only have trust when there's true accountability and true transparency. County Executive Officer Brooks' administration is committed to these principles. It's also about building relationships. And it's hard to trust someone you don't know. So it's about building those relationships. And to build a relationship, you have to listen. And that's where we are right now. The county executive and her administration is listening. Also, I wanted to thank the county executive and the council for the funding for the body-worn cameras. By the end of this calendar year, all uniform patrol officers will be equipped with these cameras, which I think is a huge step in transparency and trust within the community.
Thank you, sir. All right. In education, how do reopening phases affect PDCPS? Or is there thought about that?
David, I'll take on that question. This is George asking you. I think like all of the county, the school is impacted by the phased in approach to reopening. There's a structure that they're given guidance on by the state, and also they follow the guidance here in the county. Right now, the schools are beginning to bring back some of their staff to get prepared for the fall term. Now making decisions about just what that fall term will look like. And there are we recently the PGCPS recently sent out a survey to parents to get their opinion on how they would much prefer the school year to look, the school term to look this coming fall, and working with that information and what they also know about what's happening with the virus, they will be making decisions about how they were going to phase in their approach to bringing children back as safely as possible. Safe for the kids, safe for the staff, safe for the faculty.
Thank you, sir. As we move into the summer, can you explain the bulky trash process?
Yes. Good evening. As you know, bulky trash refers to those items that are not collected on a routine basis that are household trash and garbage items. Bulky trash was suspended at the beginning of this pandemic because it wasn't clear exactly how the coronavirus spread. And because bulky trash items were collected directly from the sidewalk by employees, until we learned more about the science, Prince George's County, as well as numerous other jurisdictions across the country, suspended that program. As it occurred, the quarantine had an effect on that because as people were stuck at home, they started to clean out their garages and their basements, and there was a pent-up demand for disposal. We recognized that and tried to design a program that we could relieve some of that demand. So beginning on June the 6th, we initiated a pop-up collection where we deployed commercial compactor trucks in all 9 council districts on a Saturday so that we could allow the residents to drop off some of the many items that they had stored up. Then beginning on the 11th of this month, we began to deploy compactor trucks in all the council districts. Beginning on the 11th, with District 8 to District 9 to District 6 to District 7. The first 3 days, we collected over 100 tons of bulky trash materials. We will continue to rotate that process with 8 commercial trucks in each council district on a rotating basis for the next 4 to 6 weeks. Beginning on July the 20th, we will begin to accept appointments where you can call in and schedule your bulky items to be picked up. These are the larger items like hot water heaters, sofas, bedroom suits, mattresses, refrigerators, stoves, and those items that you would like us to collect and deliver to the landfill. So we look forward to rolling that program back beginning on the 20th of July. Simply call 311, get on the schedule, and we will begin to pick that up. We expect to pick up about 80,000 pickups per year, about 1,500 per week. So you have to be a little patient, but we'll be there to get it. Thank you.
Thank you, DCAO Hope. So we are rounding out our program for today. I've got one more question, and then we'll turn it back to the county executive for closing us out. But before I look at the last question, I'll also get into housekeeping one more time. If you didn't hear a question that touched on something you're interested in, please email pdctownhalls@co.pg.md.us. Our very important hotline number is 301-883-6627, 301-883-6627. This is also the number where you can schedule testing appointments at county sites in Killam, Cheverly, and Laurel, Beltsville. And we want to make sure that you're making use of mypdc.us for additional resources where you can, identify donations, join our Stand Up and Deliver campaign, food pantries, and updates on phase 3 openings. And please remember to fill out your census information. Please do. Our Office of Community Relations is working around the clock to make sure you know how to get your census filled out, which brings resources home to every individual who calls Prince George's County home. So our last question is to DCO Tara Jackson from one of the most celebrated members of the Prince George's County community, Ms. Jackie Woody. Is there a coordinated effort to make virtual enrichment opportunities available for our teen and college-age youth this summer?
Well, good evening, Ms. Woody. We, in light of the pandemic, and the corresponding financial loss to the county, we have had to really make some difficult decisions. But we are excited to share that the county is currently executing a coordinated effort to conduct a modified summer youth enrichment program. As a matter of fact, next week on June 25th, we are holding a kickoff for the 2020 Summer Youth Enrichment Program. We have identified and developed multiple programs which provide a variety of work and training experiences for our county youth. Some of the work and training experiences will allow our youth to participate via virtual platforms, for instance, Healthy Communities, and a limited number of experiences will be more aligned with the traditional work experience, such as the food distribution program. But we're happy to say that the modified program will afford at least approximately 2,500 of our youth opportunities for this year. Thank you, David.
With that, I'd like to turn it over to the county executive for our closing remarks. I'd like to thank the 40,000 Prince Georgians who joined us. Ma'am?
All right. First of all, I want to say thank you so much to David Sloan and Brandon, and I want to also just thank all of the leaders who joined us from the government tonight, and to thank all of you for the tremendous work that you have done, not only during the pandemic and now as we move also through the social justice movement, but just want to thank you for what you do every day. To all of our residents who have joined the call tonight, I want to thank all of you so much for taking time tonight to come join us on this line, to ask your questions. Your engagement and your resilience and your sacrifice and advocacy are why we are who we are as Prince Georgians, the reason that our community remains so strong, and the reason that it will remain strong. So thank you so much for what you do every day. We really do appreciate you. And we're looking forward to moving forward to healing our community and to seeing this virus leave our community to stop the spread of it. And to do that, we do need your continued engagement. We ask you, please, not to stop what you have done in terms of social distancing. Please be very, very mindful that we are not done yet, that we are still in the thick of things, even though we have seen many, many declines and we have seen progress. I do want to remind you that COVID-19 is still a part of our community, and we are concerned that should we stop the social distancing and stop wearing our facial coverings and stop being vigilant, that there could be a spike, and we cannot afford to see more people get sick or to lose more lives. And so ask you, please, to continue to work with us and to thank you for what you've done so far. In every area that challenges us, we will step up to it in every instance with transparency, and we will make sure that we are held accountable and that we provide to you exactly what we promised, which is first-rate services. I want to thank Floyd and the others who have worked with bulk the trash, and I want to just thank everyone throughout the government that continues to provide the services to you, and ask you to continue to send us your feedback. When we hang up tonight, if there was an issue that you had or a question that went unanswered, I think David will provide for you the mechanism to get that question to us, because we want to answer every question and concern from this call. I want to thank Chair Todd Turner and thank the County Council for their partnership. All of the others in partnership. I want to thank our Congressman Anthony Brown and our delegation, as well as thank our state representatives, the legislators, the senators, and the delegates who work with us as well really beautifully. So thank you all so much for being on the call. God bless all of you, and it's just really an honor to serve. So thank you so much, David. I'll hand it back.
Thank you, ma'am. Thank you all for joining. If you join this call, you will be receiving a text message with the audio very soon. Thanks so much.